I'm Dr. Eppley, plastic surgeon of Indianapolis, and I'd like to talk to you about recovery after breast augmentation, specifically rapid recovery after breast augmentation. In today's modern breast augmentation surgery, there no longer is any need for an extended time of recovery from breast implant surgery. Today, most breast implants, whether they be saline or silicone, are placed underneath the muscle. Now, I realize that as silicone has come back, there may be a trend towards going above the muscle again, but the vast majority of breast augmentations that are done today are done underneath the muscle. And while it is true that raising up your pectoralis muscle definitely causes some discomfort, and particularly releasing some of the muscle down on the low end of the sternum to get the ideal position of the implant, that does not mean that one will have an extended recovery period. If you think about it, submuscular or under the muscle breast augmentation surgery today is really nothing more than a big pulled muscle. How do you recover from a pulled muscle? Well, it would be no different than you would recover from a pulled muscle from any other athletic event. The key to rapid recovery after muscle injury is quick return of activity, specifically early range of motion. In my practice, at the conclusion of the breast augmentation procedure, I only place the patient in a surgical bra. There is no other dressings or bindings that are used. I encourage my patients once they go home that evening to take high doses of ibuprofen, 800 milligrams twice a day, and begin range of motion exercises. And I'm specifically talking about raising the arms and stretching them out, pulling the pectoralis muscle outward. This is going to be a little tight and will be a little sore, but the sooner you do it and the more you do it, the quicker you are going to recover. One can certainly do, if it is not too uncomfortable, to lay or sleep on the breast implants. That's another method that really, just for many hours, if you can take it, helps stretch out the muscle. The more you use it, the quicker you're going to recovery. I have found with this approach that most women within 24 to 48 hours really no longer need any pain medication, and you should be back to many of your routine activities of daily living, short of strenuous exercises, within 24 to 48 hours. You simply wear your surgical bra. There is no magic in that bra. The bra is simply there for support, and if it feels more comfortable on than off, then go ahead and wear it. However, if you prefer to have it off because it feels better, you certainly can leave it off. You also want to start showering the next day, regardless of whether the incision is placed underneath the breast or in the armpit. And within about a week, you can get back to your exercise program, and within several weeks, you can get back to even strenuous upper body or chest muscle type exercises. In regards to work, I think how quickly you return to work will depend on what type of job you do. If it is a sit-down type of job, then you're really going to be back within days. If it is a more strenuous factory or construction job where there is a lot of strenuous activity of the arms, it may take you 7 to 10 days before you'll feel comfortable going back to do that. And in some cases, maybe as long as 2 weeks. But for the average patient who has breast augmentation today, they can really be back to work within days, and most of their activities within a day or two. I place no restrictions on how much you can lift, so you can certainly feel free to lift your children and do housework as you see fit. This is what we call rapid recovery breast augmentation, and it is highly successful. And to the surprise of many patients, one does not need an extended time of recovery after breast augmentation surgery. I wish you luck on your breast augmentation surgery, and I hope this information has been helpful. I'm Dr. Eppley, plastic surgeon of Indianapolis.